spending your morning with us. I appreciate you sacrificing a beautiful weekend for this. It's important to get this information out to people living with epilepsy and family members of people living with epilepsy, so that the boundaries of the disease, what you're dealing with, and what your options are, ideally to get toward a cure. Surgery, unfortunately, historically has been underappreciated as an option. I think because it seems off-putting or scary. In medicine, we tend to approach problems by applying the easiest and safest things first. And obviously, taking a medication is easier and safer than any surgical option. And so all medicines are on the table to try before you get to the point where you consider a surgery. Surgery does have a place if you have tried several medications and are not achieving seizure freedom. At some point, you need to consider a surgical option. Surgery over the last 20 or 30 years has become much safer and much more powerful at treating epilepsy. And I'll show you some of the very modern, very sort of cutting edge options that we have available to us. Why not surgery for everybody right up front? Well, it's sort of obvious, right? There are risks with any surgery. There's a risk of bleeding. There's a risk of infection. Part of any epilepsy surgery is an intent to damage the part of the brain causing epilepsy, either by removing it or ablating it, or by putting an electrode very near it to reprogram the part of the brain that's causing seizures. And so those risks are never taken lightly. The options for epilepsy surgery are broadly split into two categories. One involves reprogramming that area of the brain, and one involves removing the part of the brain that's damaged and causing epilepsy. And so I'll talk about the different options within both of these. Any patient's story that has epilepsy is often, by the time they see a surgeon, has been a very long story. You've dealt with the problem for years, and you've accumulated years of seizures that have not been able to be completely eliminated with medication. Along the way, you may end up speaking to a surgeon or seeing a surgeon about a surgical investigation of the epilepsy without the intent to cure it straight away, involving the placement of electrodes into the brain, sort of an intracranial, intra-brain EEG that many epilepsy patients have undergone the scalp version of. There's a much more invasive, involved version of that EEG, where you sit in the hospital with electrodes in your brain for sometimes a week or two, trying to understand exactly where those seizures are coming from so that we can offer you the best surgical treatment possible. The sort of oldest implant for epilepsy is a vagal nerve stimulator, and this is one of the lowest risk surgical options that we have available. It's a small surgery involving a little cut in the neck where we find a nerve called the vagus nerve and wrap a little electrode around it, and then connect that wire to basically a battery similar to a pacemaker that stimulates that vagus nerve. And that's been shown to reduce seizure frequency in most patients that end up having that. It's not a first-line treatment. It's not the first option that we go to because we know it's not usually 100% effective. And we are, in almost all patients, expecting and hoping that we can cure the epilepsy. This is one of the newest treatments, an implant for epilepsy that actually is a repurposed implant that has been around for decades for the treatment of Parkinson's. And this is one of the surgeries I do the most of. And only very recently has this company, Medtronic, achieved a sufficient body of evidence proving that this works to reduce seizure frequency in epilepsy patients that the FDA said, yeah, go ahead and offer this to patients with epilepsy. And so we have a huge amount of experience in doing this surgery um, for Parkinson's patients, and it's exactly the same surgery with just a slightly different target when we're treating epilepsy. This, again, involves sort of a battery under the skin of the chest, similar to a pacemaker, only the wires are connected to a deep part of the brain. One of the most exciting options for patients with epilepsy that I'm sure you've heard of is neuropace, also called responsive neurostimulation. And what this is essentially a small computer that sits in a gap that I would make in the skull. That little computer is connected to wires that go into the parts of the brain that we think are causing epilepsy. That computer can sit there and listen in on that part of the brain to see if it's going to cause a seizure. And if it looks like it's starting to cause a seizure, we can stimulate and preemptively quiet down that part of the brain so that the seizure that is starting can't spread into a full-blown epileptic attack. So this tends to work pretty well, and you can imagine computers are getting better and faster all the time, and so that same kind of Moore's law curve where computers improve and improve and improve, that applies to some of the medical devices that we can apply to epilepsy now. And so we have things like 11-year battery life on this device, and new versions coming out, new software coming out, and the rates of seizure reduction are impressive. And one of the oldest possible treatments for epilepsy is just to take out the part of the brain that we think is causing the seizure, so-called resection. And that might take the form of either, if we know very clearly which part of the brain is causing epilepsy and you're not using that part of the brain too much in your daily life, we can remove it. Most people wake up completely normal from that kind of surgery. That's very often the temporal lobe, sometimes a different part of the brain. One of the other very new, very exciting options that we do a lot of is laser ablation. And so this falls into the category of minimally invasive surgery. So we don't even need to make an incision, say a cut with a knife in your skin for this. We can make basically a needle hole in the skin that's 2 millimeters wide, and then drill a 2 millimeter hole in the skull and insert a laser fiber optic into the area of the brain that is causing seizures. And then, as you can see in this video of one of my previous patients, we just heat up that area of the brain with a laser and watch that heating happen in real time in an MRI machine while you're asleep. And we can get rid of the part of the brain that's causing epilepsy with a very, very small opening in the skin. So some of the typical assumptions that people have about surgery don't apply to all of the surgical options. And so we can see some very excellent results with this as well. I'm sorry I have to leave. I'm quite busy today. I have a couple patients that need me, but I want to leave you with the idea that surgery is underutilized. It's incredibly powerful. Too often people live with ongoing seizures for too long. And we always want to strive for a cure. We want to have you never have another seizure in your life. So if we can get to that point, we're gonna do whatever we can for you to get there. Thank you.